Question 1. Strategic planning requires HealthSouth to consider new operational efficiencies. A proposed initiative suggests implementing a new scheduling software that could significantly reduce administrative overhead. However, preliminary reviews indicate that the software's interface might be less intuitive for some long-term staff, potentially leading to minor delays in patient appointment booking during the transition. What is the most appropriate course of action for HealthSouth's leadership to take? Option A. Delay the implementation of the new scheduling software indefinitely until a perfectly intuitive system is identified, to avoid any possibility of patient inconvenience. Option B. Proceed with the implementation of the new scheduling software, providing additional training to staff to mitigate any potential booking delays, and conduct post-implementation audits to monitor patient care impact. Option C. Explore alternative software solutions that offer similar cost savings but have a proven track record of seamless integration with existing workflows and minimal disruption to patient scheduling. Option D. Implement the new scheduling software immediately to realize cost savings, assuming that any minor booking delays will be resolved by staff over time without specific intervention. The correct answer is B. Proceed with the implementation of the new scheduling software, providing additional training to staff to mitigate any potential booking delays, and conduct post-implementation audits to monitor patient care impact. Explanation: this scenario presents a professional challenge because it requires balancing the company's strategic goals with its ethical and regulatory obligations, particularly concerning patient care and data privacy. HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patient well-being and ensure the integrity of healthcare services. The decision-maker must navigate potential conflicts between efficiency gains and patient safety, and between business objectives and compliance requirements. Careful judgment is essential to avoid actions that could lead to regulatory penalties, reputational damage, or harm to patients. The correct approach involves prioritizing patient care and regulatory compliance above all else when evaluating strategic initiatives. This means thoroughly assessing any proposed change for its impact on patient outcomes, safety protocols, and adherence to all applicable healthcare laws and regulations, such as HIPAA in the United States. The justification for this approach lies in the fundamental ethical duty of healthcare providers to act in the best interest of their patients and to operate within the legal framework governing healthcare. Prioritizing patient well-being and regulatory adherence ensures that strategic planning contributes to, rather than compromises, the core mission of providing quality healthcare. An incorrect approach that focuses solely on cost reduction without a comprehensive patient impact assessment fails to meet regulatory standards. For instance, implementing a new technology or process that streamlines operations but potentially introduces errors or delays in patient treatment would violate the principle of patient safety and could lead to violations of healthcare quality regulations. Another incorrect approach that involves bypassing established patient consent procedures for data utilization, even for strategic analysis, would directly contravene patient privacy laws like HIPAA, resulting in severe legal and financial repercussions. A third incorrect approach that prioritizes speed of implementation over thorough due diligence regarding regulatory compliance risks, overlooking critical requirements, leading to noncompliance and potential sanctions. Professionals should employ a decision-making framework that begins with identifying all relevant stakeholders and their interests, including patients, regulators, and the company. Next, they must identify all applicable laws, regulations, and ethical guidelines. The evaluation of any strategic initiative should then involve a risk assessment that explicitly considers potential impacts on patient care, safety, privacy, and regulatory compliance. Decisions should be made based on a thorough understanding of these risks and a commitment to the highest ethical and legal standards, seeking expert advice when necessary to ensure comprehensive compliance and patient protection. Question 2. Governance review demonstrates that a HealthSouth physical therapist, while reviewing patient charts for a colleague who is currently on leave, notices a pattern of services being billed for a specific patient that appear to be more frequent than medically necessary for the patient's documented condition and progress. The therapist also knows that this patient is a close friend of the colleague who is on leave. What is the most appropriate course of action for the HealthSouth physical therapist? Option A. Use the information to subtly suggest to the colleague on leave that they might want to review their billing practices upon their return. Option B. Directly discuss the billing pattern with the colleague's friend, the patient, to understand their perspective on the treatment frequency. Option C. Report the observed billing pattern and potential overutilization of services to the HealthSouth Compliance Department or their direct supervisor. Option D. Ignore the observation, assuming the colleague on leave is aware of the billing, and it is not the therapist's responsibility to intervene. Correct answer is C. Report the observed billing pattern and potential overutilization of services to the HealthSouth Compliance Department or their direct supervisor. Explanation: this scenario presents a professional challenge because it requires an individual to navigate a potential conflict of interest and uphold the ethical standards expected of employees within a healthcare organization like HealthSouth. The core of the challenge lies in recognizing and acting upon information that could benefit a related party while potentially compromising the organization's integrity or patient care. Careful judgment is required to ensure that all actions align with HealthSouth's policies and relevant healthcare regulations. The correct approach involves promptly and transparently reporting the observed information through the designated channels within HealthSouth. This demonstrates a commitment to ethical conduct and adherence to internal compliance procedures. Specifically, reporting the potential overutilization of services to the compliance department or a designated supervisor ensures that the organization can investigate the matter objectively and take appropriate corrective action, if necessary. This aligns with the ethical obligation to act in the best interest of the organization and its patients, and to prevent potential fraud, waste, or abuse, which are critical concerns in healthcare. An incorrect approach would be to ignore the observation, assuming it is not significant or that it is someone else's responsibility to address. This failure to report a potential issue is a breach of professional responsibility and could allow unethical or illegal practices to continue, potentially harming patients and the organization's reputation. Another incorrect approach would be to directly confront the individual involved without following established reporting procedures. While well-intentioned, this bypasses the organization's compliance framework, could lead to an unproductive or confrontational situation, and fails to engage the appropriate internal resources for investigation and resolution. Finally, an incorrect approach would be to use the information for personal gain or to benefit a friend or family member outside of the proper channels. This constitutes a clear conflict of interest and a violation of ethical and potentially legal standards. Professionals in this situation should utilize a decision-making framework that prioritizes ethical considerations and adherence to organizational policy. This involves 1. Identifying the potential ethical or compliance issue. 2. Consulting internal policies and procedures regarding reporting and conflicts of interest. 3. Following the established reporting hierarchy or compliance channels. 4. Documenting the observation and the actions taken. 5. Maintaining confidentiality throughout the process. This systematic approach ensures that issues are addressed appropriately and ethically, protecting both the individual and the organization. Question 3. Governance review demonstrates that HealthSouth's patient intake documentation process has a recurring pattern of incomplete entries and missing signatures, potentially impacting billing accuracy and continuity of care. Which of the following actions should be prioritized to address this issue? Option A. Conduct a brief, company-wide memo reminding staff of the importance of complete documentation and the potential consequences of errors. Option B. Delegate the responsibility for ensuring complete documentation to individual patient care teams without providing additional resources or standardized training. Option C. Focus on streamlining the intake form to reduce the number of required fields, assuming that fewer fields will lead to fewer errors. Option D. Implement a mandatory multi-stage review process for all new patient intake forms, requiring sign-off from a designated compliance officer before the patient record is finalized. Correct answer is D. Implement a mandatory multi-stage review process for all new patient intake forms, requiring sign-off from a designated compliance officer before the patient record is finalized. Explanation: this scenario presents a professional challenge because it requires balancing operational efficiency with strict adherence to regulatory compliance, specifically concerning patient care standards and documentation within the healthcare industry. The HealthSouth hiring assessment test likely evaluates a candidate's understanding of these critical areas. Careful judgment is required to ensure that any proposed solution upholds the integrity of patient records, and complies with all applicable healthcare regulations. The correct approach involves a thorough, systematic review of the existing documentation process, identifying specific deficiencies, and proposing targeted improvements that align with regulatory requirements for accuracy, completeness, and timeliness. This approach is best professional practice because it directly addresses the identified governance issue by seeking to rectify the root causes of potential noncompliance. Regulatory frameworks, such as those governing healthcare providers in the United States, e.g., HIPAA, Medicare Conditions of Participation, mandate accurate and complete patient records for continuity of care, billing, and legal purposes. Implementing a structured review and improvement plan ensures that HealthSouth's practices meet these stringent standards, mitigating risks of penalties, reputational damage, and compromised patient safety. An incorrect approach that focuses solely on expediting the documentation process without addressing the underlying quality issues would be professionally unacceptable. This failure stems from prioritizing speed over accuracy and compliance, potentially leading to incomplete or inaccurate records. Such an approach risks violating regulations that require thorough documentation, thereby jeopardizing patient care and exposing HealthSouth to significant legal and financial repercussions. Another incorrect approach that involves overlooking minor discrepancies in documentation, assuming they are inconsequential, is also professionally unacceptable. This demonstrates a lack of understanding of the cumulative impact of documentation errors and a disregard for the principle of meticulous record-keeping. Even seemingly minor omissions or inaccuracies can have serious consequences, affecting billing, audits, and the ability of other healthcare professionals to make informed decisions about patient treatment. This approach fails to uphold the ethical obligation to maintain accurate patient information and violates regulatory expectations for comprehensive documentation. A third incorrect approach that involves implementing a new, complex documentation system without adequate training or consideration for existing workflows would be professionally unacceptable. While the intention might be to improve documentation, this approach ignores the practical realities of implementation and the importance of staff buy-in and proficiency. It risks creating more problems than it solves, leading to frustration, increased errors due to unfamiliarity, and potential noncompliance if the system is not used correctly. This approach fails to consider the human element and the practical application of new processes within the regulatory framework. The professional decision-making process for similar situations should involve a structured problem-solving methodology. First, clearly define the problem and its potential impact, referencing specific regulatory requirements. Second, gather all relevant information and data. Third, brainstorm and evaluate potential solutions, considering their feasibility, cost, and most importantly, their compliance with all applicable laws and regulations. Fourth, select the most appropriate solution, develop an implementation plan, and establish metrics for success. Finally, monitor the effectiveness of the implemented solution and make adjustments as needed, always prioritizing patient well-being and regulatory adherence. Question 4. Cost-benefit analysis shows that a new patient scheduling software could significantly reduce administrative overhead for HealthSouth. However, the software requires access to a broad range of patient demographic and clinical data. Which of the following represents the most responsible and compliant approach for HealthSouth to take before adopting this software? Option A. Implement the software and address any potential compliance issues that arise after go live. Option B. Prioritize the cost savings identified in the analysis and implement the software, assuming patient data will be handled appropriately. Option C. Proceed with implementation immediately, relying on the vendor's assurances that the software is HIPAA compliant. Option D. Conduct a thorough impact assessment focusing on patient data privacy, security, and compliance with all applicable healthcare regulations, developing mitigation strategies for identified risks. The correct answer is C. Proceed with implementation immediately, relying on the vendor's assurances that the software is HIPAA compliant. Explanation. This scenario presents a professional challenge because HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The decision to implement a new technology requires a careful balance between operational efficiency and compliance with these regulations. The challenge lies in identifying potential conflicts between the perceived benefits of the technology and the legal and ethical obligations HealthSouth has towards its patients and regulatory bodies. The correct approach involves a comprehensive impact assessment that prioritizes patient data security and regulatory adherence. This means thoroughly evaluating how the new technology will affect patient privacy, data integrity, and compliance with relevant healthcare laws, such as HIPAA in the United States. It requires proactive identification of risks and the development of mitigation strategies to ensure that the implementation does not lead to breaches of confidentiality, unauthorized access, or noncompliance with reporting requirements. This approach aligns with the ethical duty of care and the legal mandate to protect sensitive patient information. An incorrect approach would be to proceed with implementation based solely on the cost-benefit analysis without a dedicated impact assessment. This overlooks the critical regulatory and ethical dimensions. For instance, if the technology involves data sharing, failing to assess its compliance with HIPAA privacy and security rules would be a significant regulatory failure, potentially leading to substantial fines and reputational damage. Another incorrect approach would be to assume that vendor assurances of compliance are sufficient without independent verification. This abdicates responsibility and could result in HealthSouth being held liable for the vendor's noncompliance. Furthermore, prioritizing cost savings over patient data protection is an ethical failure, as it subordinates patient well-being and privacy to financial considerations, violating fundamental principles of healthcare ethics. Professionals should employ a decision-making framework that begins with identifying all relevant stakeholders and their interests, including patients, regulators, and the organization. This framework should then involve a systematic risk assessment process, focusing on regulatory compliance, data security, and ethical implications. For any new technology or process, a thorough impact assessment should be conducted, documenting potential risks and outlining specific controls and mitigation strategies. This assessment should be reviewed and approved by legal and compliance departments before implementation. Continuous monitoring and auditing post-implementation are also crucial to ensure ongoing adherence to regulations and ethical standards. Question 5. System analysis indicates that HealthSouth is considering a new electronic health record (EHR) system to improve efficiency. What approach should HealthSouth prioritize when evaluating the implementation of this new EHR system to ensure both operational improvements and adherence to healthcare regulations? Option A. Focus solely on the system's ability to reduce administrative overhead and streamline billing processes for HealthSouth. Option B. Prioritize the fastest and most cost-effective system implementation to realize immediate operational benefits for HealthSouth. Option C. Rely on feedback from a small group of IT staff and department managers to gauge the system's suitability and compliance. Option D. Conduct a comprehensive impact assessment that evaluates potential effects on patient safety, data privacy, regulatory compliance, and clinical workflows before full implementation. The correct answer is D. Conduct a comprehensive impact assessment that evaluates potential effects on patient safety, data privacy, regulatory compliance, and clinical workflows before full implementation. Explanation: this scenario presents a professional challenge because it requires HealthSouth employees to navigate potential conflicts between operational efficiency and regulatory compliance. The pressure to meet performance targets can inadvertently lead to shortcuts that compromise patient care standards or data integrity, which are heavily regulated in the healthcare industry. Careful judgment is required to balance business objectives with the ethical and legal obligations HealthSouth has to its patients and regulatory bodies. The correct approach involves a proactive and comprehensive impact assessment that prioritizes patient safety and regulatory adherence above immediate operational gains. This approach is best professional practice because it aligns with the fundamental principles of healthcare ethics and the stringent requirements of healthcare regulations, such as those enforced by the Centers for Medicare and Medicaid Services, CMS, and the Health Insurance Portability and Accountability Act, HIPAA. By systematically evaluating the potential effects on patient outcomes, data privacy, and compliance, HealthSouth can identify and mitigate risks before they manifest, ensuring that any changes or initiatives do not inadvertently lead to patient harm or regulatory violations. This demonstrates a commitment to responsible business practices and patient well-being. An incorrect approach that focuses solely on cost reduction without considering patient impact would be professionally unacceptable. This failure stems from a disregard for the core mission of healthcare, which is patient welfare. Such an approach risks violating regulations designed to protect patients, potentially leading to severe penalties, reputational damage, and most importantly, compromised patient care. Another incorrect approach that prioritizes speed of implementation over thorough risk analysis is also professionally unacceptable. In healthcare, rushing processes without adequate assessment can lead to unforeseen errors in patient treatment, billing inaccuracies, or data breaches. This demonstrates a lack of due diligence and a failure to uphold the professional standards expected in a regulated environment. A third incorrect approach that relies on anecdotal evidence or the opinions of a few individuals rather than systematic data analysis for decision-making is professionally unsound. Regulatory compliance and patient safety require objective, evidence-based assessments. Relying on informal feedback can overlook critical systemic issues or potential negative consequences that only a structured impact assessment can uncover. The professional decision-making process for similar situations should involve a structured framework. First, clearly define the proposed change or initiative. Second, identify all relevant stakeholders, including patients, staff, and regulatory bodies. Third, conduct a thorough impact assessment, considering patient safety, clinical outcomes, data privacy, operational efficiency, and regulatory compliance. Fourth, develop mitigation strategies for identified risks. Fifth, implement the change with ongoing monitoring and evaluation. Finally, maintain open communication channels to address any emerging issues promptly. This systematic approach ensures that decisions are informed, ethical, and compliant with all applicable regulations. Question 6. Benchmark analysis indicates that HealthSouth is considering the rapid adoption of a new patient management software system to enhance operational efficiency. Which of the following approaches best ensures compliance with patient privacy regulations and data security protocols during this implementation? Option A. Conduct a comprehensive impact assessment that evaluates potential effects on patient privacy, data security, operational workflows, and regulatory compliance, and develop mitigation strategies accordingly. Option B. Rely on vendor assurances regarding data security and privacy without conducting an independent assessment of the system's compliance with HealthSouth's specific regulatory obligations. Option C. Focus primarily on the technical integration and functionality of the new software, with minimal consideration for its impact on patient data. Option D. Proceed with the software implementation immediately to realize efficiency gains, assuming existing security measures will suffice. The correct answer is A. Conduct a comprehensive impact assessment that evaluates potential effects on patient privacy, data security, operational workflows, and regulatory compliance, and develop mitigation strategies accordingly. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's operational needs and the regulatory obligations to ensure patient safety and data privacy. HealthSouth, as a healthcare provider, operates under strict federal regulations, primarily the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which governs the privacy and security of protected health information, FI. The pressure to quickly implement new technology for efficiency must be balanced against the legal and ethical imperative to safeguard patient data. Careful judgment is required to navigate this tension without compromising compliance or patient trust. The correct approach involves a thorough, multifaceted impact assessment that systematically evaluates the potential effects of the new technology on all relevant areas, including patient privacy, data security, operational workflows, and regulatory compliance. This approach is best professional practice because it proactively identifies risks and vulnerabilities before they materialize. Specifically, it aligns with HIPAA security rule, which mandates risk analysis and management to protect electronic PHI, and its privacy rule, which sets standards for the use and disclosure of PHI. By conducting a comprehensive assessment, HealthSouth can develop appropriate safeguards, policies, and training to mitigate identified risks, ensuring that the technology implementation adheres to all legal requirements and ethical standards for patient data protection. An incorrect approach that prioritizes speed over thoroughness by proceeding with implementation without a detailed impact assessment would represent a significant regulatory and ethical failure. This would violate HIPAA requirement for risk analysis and the implementation of security measures. It could lead to unauthorized access, disclosure, or breaches of PHI, resulting in substantial fines, legal penalties, and reputational damage. Another incorrect approach, focusing solely on the technical aspects of the new system while neglecting its implications for patient privacy and data security, would also be professionally unacceptable. This oversight would fail to address the core requirements of HIPAA, which mandates a holistic approach to protecting health information. Finally, an approach that relies on assumptions about compliance without verification would be negligent. This lack of due diligence could mask underlying vulnerabilities and lead to unintentional noncompliance, exposing HealthSouth to significant risks. The professional decision-making process for similar situations should involve a structured risk management framework. This begins with identifying all potential impacts of a proposed change, followed by assessing the likelihood and severity of those impacts. Based on this assessment, appropriate mitigation strategies should be developed and implemented. Continuous monitoring and evaluation are crucial to ensure that safeguards remain effective and that compliance is maintained. In situations involving sensitive data like PHI, a proactive and comprehensive approach, guided by regulatory requirements and ethical principles, is paramount. Question 7. Cost-benefit analysis shows that implementing a new patient scheduling and communication platform at HealthSouth could significantly reduce administrative overhead and improve patient engagement. However, the platform involves cloud-based data storage and uses a third-party vendor for its communication features. Which of the following approaches best ensures HealthSouth's compliance with federal healthcare regulations and ethical patient care standards? Option A. Implement the platform immediately to gain a competitive advantage and address any potential compliance issues that arise after the rollout. Option B. Conduct a thorough impact assessment that includes a detailed review of the platform's data security protocols, the vendor's compliance with HIPAA, and potential effects on patient privacy and access to care before making a final decision. Option C. Rely on HealthSouth's existing IT security infrastructure to manage the new platform's data, without independently verifying the vendor's specific security capabilities or their adherence to healthcare data regulations. Option D. Proceed with the implementation, assuming the vendor's standard security measures are adequate and focusing primarily on the projected cost savings and efficiency gains. Correct answer is D. Proceed with the implementation, assuming the vendor's standard security measures are adequate and focusing primarily on the projected cost savings and efficiency gains. Explanation. This scenario presents a professional challenge because HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The decision to implement a new technology requires a careful balance between operational efficiency and compliance with these regulations. The core of the challenge lies in assessing the potential benefits against the risks, particularly concerning data security and patient rights, without compromising the quality of care or violating legal mandates. The correct approach involves a comprehensive impact assessment that prioritizes patient privacy and regulatory compliance. This means thoroughly evaluating how the new technology will affect patient data, ensuring that all data handling practices align with Health Insurance Portability and Accountability Act, HIPAA, security rule requirements. This includes assessing potential vulnerabilities, implementing robust security measures, and ensuring that any third-party vendors involved also adhere to HIPAA. Furthermore, it necessitates a review of how the technology might impact patient access to care and the overall patient experience, ensuring no adverse effects. This proactive, compliance-first strategy is essential for maintaining patient trust and avoiding legal repercussions. An incorrect approach would be to proceed with the technology implementation based solely on projected cost savings, without a thorough assessment of its impact on patient privacy and regulatory adherence. This failure to conduct a comprehensive impact assessment, particularly regarding HIPAA compliance, could lead to significant data breaches, unauthorized disclosure of protected health information (FI), and substantial fines. Another incorrect approach would be to assume that standard data security protocols are sufficient without a specific evaluation of the new technology's unique risks and how they interact with existing HealthSouth systems and patient data. This oversight could leave vulnerabilities unaddressed. Finally, prioritizing speed of implementation over a detailed review of patient rights and consent mechanisms would be a critical ethical and regulatory failure, potentially undermining patient autonomy and trust. Professionals should approach such decisions by first identifying all applicable regulations, e.g., HIPAA, High-Tech Act. They should then conduct a systematic risk assessment, focusing on data security, patient privacy, and potential impacts on care delivery. This assessment should involve relevant stakeholders, including IT security, legal counsel, compliance officers, and clinical staff. The decision-making process should be guided by a principle of privacy by design, ensuring that privacy and security are integrated into the technology from its inception. Any potential benefits must be weighed against the identified risks, with a clear plan for mitigation and ongoing monitoring to ensure sustained compliance. Question 8. Upon reviewing a list of potential vendors for a new patient management software system at HealthSouth, you notice that one of the highly rated vendors is represented by an individual with whom you have a close personal friendship outside of work. This vendor has been recommended by a colleague who is aware of your friendship. How should you proceed with the vendor evaluation process? Option A. Conduct the evaluation but subtly adjust the scoring criteria to favor your friend's company, rationalizing that their familiarity with your needs might be an advantage. Option B. Immediately disqualify the vendor from consideration due to the personal relationship without further evaluation to avoid any appearance of impropriety. Option C. Fully disclose your personal relationship to your supervisor and the compliance department, and proceed with the evaluation only after receiving clear guidance on managing the potential conflict, ensuring all evaluation criteria are applied objectively and documented thoroughly. Option D. Proceed with the evaluation as planned, assuming your professional judgment will not be influenced by your personal friendship, and do not mention the relationship to anyone. The correct answer is C. Fully disclose your personal relationship to your supervisor and the compliance department, and proceed with the evaluation only after receiving clear guidance on managing the potential conflict, ensuring all evaluation criteria are applied objectively and documented thoroughly. Explanation. This scenario presents a professional challenge because it requires an individual to navigate potential conflicts of interest and ensure compliance with HealthSouth's internal policies and relevant healthcare regulations. The core issue is maintaining objectivity and avoiding any perception of impropriety when evaluating a vendor that has a pre-existing relationship with a key decision maker. Careful judgment is required to uphold ethical standards and regulatory requirements, ensuring that all vendor selections are based on merit and the best interests of HealthSouth and its patients, not personal connections. The correct approach involves a thorough, unbiased assessment of all potential vendors, irrespective of any personal relationships. This approach upholds the principle of fair competition and ensures that HealthSouth secures the most advantageous terms and services. Specifically, it aligns with regulatory frameworks that mandate transparency and prohibit conflicts of interest in procurement processes. By documenting the evaluation criteria and the rationale for selection, and by disclosing any potential conflicts, the individual demonstrates adherence to ethical business practices and regulatory expectations for due diligence. An incorrect approach that involves overlooking the potential conflict of interest and proceeding with the evaluation without disclosure or additional scrutiny is professionally unacceptable. This failure to acknowledge and manage the conflict could lead to a biased selection process, potentially resulting in suboptimal contract terms for HealthSouth or even violations of anti-kickback statutes if the relationship is perceived to influence the decision. Another incorrect approach, which is to immediately disqualify the vendor due to the personal relationship without a fair evaluation, is also professionally flawed. While it avoids the appearance of impropriety, it may deprive HealthSouth of a potentially superior vendor and service, which is not in the company's best interest. This approach fails to balance the need for ethical conduct with the business imperative of selecting the best vendor. A third incorrect approach, which is to proceed with the evaluation, but to allow the personal relationship to influence the assessment criteria or weighting, represents a direct breach of ethical and regulatory standards. This constitutes a conflict of interest that compromises the integrity of the procurement process and could lead to significant legal and reputational damage for HealthSouth. The professional decision-making process for similar situations should involve 1. Identifying any potential conflicts of interest, including personal relationships with vendors or their representatives. 2. Disclosing these potential conflicts to the appropriate supervisory personnel or ethics committee. 3. Seeking guidance on how to proceed, which may include recusal from the decision-making process or implementing enhanced oversight. 4. Ensuring that all evaluations are conducted objectively, based on predefined criteria, and that documentation supports the final decision. 5. Adhering strictly to HealthSouth's vendor selection policies and all applicable healthcare regulations. Question 9. The risk matrix shows a moderate likelihood of patient falls and a high impact on patient recovery due to delayed treatment following adverse events at HealthSouth's rehabilitation facility. Which of the following approaches best addresses these identified risks in compliance with healthcare regulations? Option A. Reduce the frequency of certain diagnostic imaging tests to manage departmental budgets more effectively, thereby indirectly freeing up resources for other areas. Option B. Document all identified risks and defer any corrective actions until the next scheduled comprehensive compliance audit. Option C. Implement mandatory retraining for all clinical staff on existing patient handling techniques and emergency response protocols. Option D. Conduct a thorough review and update of HealthSouth's patient fall prevention protocols and post-event response procedures, incorporating best practices and recent clinical guidelines. The correct answer is D. Conduct a thorough review and update of HealthSouth's patient fall prevention protocols and post-event response procedures, incorporating best practices and recent clinical guidelines. Explanation. This scenario presents a professional challenge because it requires balancing operational efficiency with patient safety and regulatory compliance within the specific context of HealthSouth's operations. The risk matrix highlights potential areas of concern, and the chosen approach must directly address these risks in a manner consistent with healthcare regulations and ethical patient care standards. The core difficulty lies in identifying the most effective and compliant method to mitigate identified risks without compromising the quality of care or introducing new liabilities for HealthSouth. The correct approach involves a comprehensive review and enhancement of existing patient care protocols. This is the most appropriate because it directly addresses the root causes of potential risks identified in the matrix by improving the processes that govern patient treatment and monitoring. Regulatory frameworks governing healthcare providers, such as those overseen by CMS, Centers for Medicare and Medicaid Services, and state health departments, mandate that facilities maintain and regularly update protocols to ensure patient safety and quality of care. Ethically, this approach prioritizes patient well-being by proactively strengthening the safeguards in place. An approach focused solely on staff retraining without protocol revision is insufficient. While retraining is important, it assumes the existing protocols are adequate. If the protocols themselves are flawed or outdated, retraining staff on them will not effectively mitigate the risks. This could lead to continued suboptimal care and potential regulatory noncompliance, as the underlying systemic issues remain unaddressed. An approach that prioritizes cost reduction by limiting diagnostic testing is ethically and regulatorily unsound. Patient care decisions must be driven by clinical necessity and patient well-being, not by cost-saving measures that could compromise diagnosis or treatment. Such an approach would directly violate the duty of care owed to patients and would likely contravene regulations that require appropriate diagnostic procedures. An approach that involves deferring all identified risks to a future compliance audit is negligent. Regulatory compliance is an ongoing responsibility, not a periodic check. Waiting for an audit to address identified risks means that patients could be exposed to harm during the interim period. This demonstrates a lack of proactive risk management and a failure to uphold the immediate duty to ensure patient safety and regulatory adherence. Professionals should employ a decision-making framework that begins with a thorough understanding of the identified risks and their potential impact. This understanding should then be cross-referenced with applicable regulatory requirements and ethical principles. The chosen approach must be proactive, evidence-based, and demonstrably aimed at improving patient outcomes and operational integrity. When evaluating options, professionals should ask, does this approach directly address the identified risks? Is it compliant with all relevant regulations? Does it uphold ethical standards of patient care? Is it sustainable and effective in the long term? Question 10. The performance metrics show a consistent decline in patient satisfaction scores in several HealthSouth rehabilitation centers, alongside an increase in reported overtime hours for clinical staff. Which approach best addresses this situation? Option A. Focus solely on improving patient satisfaction survey administration to ensure more positive responses, without investigating the underlying operational issues. Option B. Conduct a comprehensive review of staffing levels, clinical workflows, and patient care protocols to identify root causes for both declining satisfaction and increased overtime, and develop targeted interventions. Option C. Implement immediate staffing reductions in departments with the lowest patient satisfaction scores to control labor costs, assuming staff fatigue is the primary driver of dissatisfaction. Option D. Reassign administrative staff to clinical roles to alleviate overtime and boost patient interaction, without assessing their qualifications or the impact on patient care. The correct answer is B. Conduct a comprehensive review of staffing levels, clinical workflows, and patient care protocols to identify root causes for both declining satisfaction and increased overtime, and develop targeted interventions. Explanation. This scenario presents a professional challenge because it requires balancing the need for operational efficiency and cost reduction with the ethical and regulatory obligations to provide quality patient care and maintain accurate financial reporting. HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patients and ensure financial integrity. Misinterpreting or misapplying performance metrics can lead to decisions that compromise patient well-being, violate regulatory compliance, or damage the company's reputation. Careful judgment is required to ensure that any actions taken are both legally sound and ethically responsible. The correct approach involves a thorough and objective assessment of the performance metrics, considering all contributing factors and potential impacts on patient care and regulatory compliance before making any decisions. This approach prioritizes understanding the root causes of any performance deviations and exploring solutions that align with HealthSouth's mission and regulatory framework. Specifically, it requires a deep dive into the data, consultation with relevant stakeholders, e.g., clinical staff, compliance officers, and a proactive stance on addressing any identified issues in a manner that upholds patient safety and regulatory adherence. This aligns with the ethical duty of care and the legal requirements for healthcare providers to operate with integrity and transparency. An incorrect approach that focuses solely on immediate cost reduction, without considering the impact on patient care, would be ethically and regulatorily unsound. Such an approach could lead to understaffing, reduced access to necessary services, or compromises in the quality of care, potentially violating patient rights and healthcare regulations. Another incorrect approach that involves manipulating or selectively interpreting performance metrics to justify predetermined cost-cutting measures would constitute a serious ethical breach and could lead to fraudulent reporting, violating financial regulations, and potentially leading to severe legal penalties. Furthermore, an approach that ignores or downplays negative performance trends without investigation risks failing to identify systemic issues that could have significant patient safety or compliance implications, thereby failing in the duty to provide a safe and effective healthcare environment. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the data and its context. This involves identifying the specific performance metrics in question, gathering all relevant supporting information, and consulting with subject matter experts. The next step is to analyze the potential implications of any observed trends or deviations, considering both operational and patient-centered perspectives, as well as the applicable regulatory landscape. Finally, decisions should be made based on a holistic evaluation that prioritizes patient well-being, regulatory compliance, and ethical conduct, rather than solely on financial targets or expediency. Question 11. Examination of the data shows a potential discrepancy in billing practices at a HealthSouth facility that could indicate a compliance issue. As a compliance officer, what is the most appropriate initial step to take to address this situation? Option A. Directly question the billing department staff about their understanding of the billing procedures. Option B. Report the potential discrepancy directly to the relevant federal regulatory agency without any internal review. Option C. Access all patient billing records related to the suspected discrepancy without prior authorization to understand the scope. Option D. Immediately begin a formal, documented internal investigation following HealthSouth's established compliance breach protocols. The correct answer is D. Immediately begin a formal, documented internal investigation following HealthSouth's established compliance breach protocols. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate need for information to address a potential compliance issue with the obligation to protect patient privacy and adhere to HealthSouth's internal policies and relevant healthcare regulations. The pressure to act quickly can lead to shortcuts that compromise ethical and legal standards. Careful judgment is required to ensure that any investigation is conducted in a manner that is both effective and compliant. Correct approach analysis. The correct approach involves initiating a formal, documented internal investigation that strictly adheres to HealthSouth's established policies and procedures for handling potential compliance breaches. This approach is correct because it ensures that the investigation is conducted systematically, with appropriate oversight, and in a manner that respects patient confidentiality and data privacy rights as mandated by federal regulations such as the Health Insurance Portability and Accountability Act, HIPAA. It also allows for the proper collection and preservation of evidence, which is crucial for determining the facts and taking appropriate corrective actions, while minimizing the risk of further breaches or legal repercussions. Incorrect approaches analysis. Initiating an informal inquiry by directly questioning staff members involved without following established protocols is an incorrect approach. This bypasses necessary procedural safeguards, potentially leading to biased information gathering, inadvertent disclosure of sensitive information, and a failure to properly document the investigation, which could violate HIPAA and internal HealthSouth policies regarding data access and breach investigation. Accessing patient records directly without a clear, documented need and authorization, even if perceived as necessary for immediate understanding, is an incorrect approach. This constitutes unauthorized access to protected health information. 5. A direct violation of HIPAA and HealthSouth's privacy policies, and could result in significant penalties and reputational damage. Escalating the issue to external regulatory bodies immediately without first conducting a thorough internal investigation is an incorrect approach. While transparency with regulators is important, premature reporting without a clear understanding of the facts can lead to unnecessary regulatory scrutiny, damage to HealthSouth's reputation, and may not be required if the issue is minor or can be resolved internally. It also fails to utilize internal resources and established compliance mechanisms. Professional reasoning. Professionals facing such a situation should first consult HealthSouth's compliance officer and relevant internal policies for handling suspected breaches or compliance issues. The decision-making process should prioritize a structured, documented, and compliant investigation. This involves identifying the scope of the potential issue, determining the appropriate personnel to conduct the investigation, ensuring all actions taken are authorized and documented, and maintaining strict confidentiality throughout the process. The goal is to gather accurate information, assess the impact, and implement corrective actions in a manner that upholds ethical standards and regulatory requirements. Question 12. Assessment of a HealthSouth physical therapist's responsibility when a close family member is a primary owner of a durable medical equipment, DME, supplier that frequently provides services to HealthSouth patients, and the therapist is considering referring patients to this supplier. Option A. Immediately disclose the familial relationship and the potential business connection to HealthSouth's compliance department, and follow their guidance on managing the potential conflict of interest. Option B. Inform the family member about the potential referral volume and discuss how the supplier can best serve HealthSouth patients without formally disclosing to HealthSouth. Option C. Downplay the familial relationship to HealthSouth management, stating it is a distant connection and unlikely to influence professional judgment. Option D. Proceed with referring patients to the DME supplier as long as the quality of care is not compromised, assuming the family member's business operates ethically. Correct answer is A. Immediately disclose the familial relationship and the potential business connection to HealthSouth's compliance department, and follow their guidance on managing the potential conflict of interest. Explanation. This scenario presents a professional challenge because it requires an individual to navigate potential conflicts of interest and ensure compliance with HealthSouth's internal policies and relevant healthcare regulations, specifically concerning patient care and financial disclosures. The core of the challenge lies in maintaining objectivity and prioritizing patient well-being and regulatory adherence over personal or familial gain. Careful judgment is required to identify and mitigate any perceived or actual conflicts that could compromise ethical standards or legal obligations. The correct approach involves a transparent and proactive disclosure of the familial relationship to the appropriate HealthSouth management and compliance departments. This demonstrates a commitment to ethical conduct and regulatory compliance by immediately flagging a potential conflict of interest. By seeking guidance and adhering to established protocols for managing such situations, the individual ensures that patient care decisions remain unbiased and that all financial arrangements are scrutinized for fairness and adherence to regulations. This approach aligns with the ethical principles of integrity, transparency, and accountability, and it proactively addresses potential violations of healthcare laws and company policy by preventing situations where personal relationships could influence professional judgment or operational decisions. An incorrect approach of proceeding with the referral without disclosure fails to acknowledge the potential for bias and violates the fundamental ethical duty of impartiality in patient care. This action could lead to regulatory scrutiny for improper patient referrals or kickbacks, depending on the specifics of the financial relationship, and breaches HealthSouth internal conflict of interest policies. Another incorrect approach of downplaying the relationship's significance to avoid scrutiny undermines the principle of transparency. Even if the relationship is not intended to influence decisions, failing to disclose, it creates an environment where such influence is possible and can lead to a loss of trust and potential disciplinary action if discovered. It also bypasses established procedures designed to protect both the patient and the organization. A third incorrect approach of seeking advice only from the family member involved in the potential referral is ethically unsound and professionally negligent. This circumvents established organizational channels for conflict resolution and advice, potentially leading to biased guidance that prioritizes personal interests over regulatory compliance and patient welfare. It also fails to involve the necessary oversight mechanisms within HealthSouth. Professionals in similar situations should employ a decision-making framework that prioritizes transparency, adherence to policy, and ethical conduct. This involves 1. Identifying potential conflicts of interest, including familial or financial relationships that could influence professional judgment. 2. Proactively disclosing these potential conflicts to the designated compliance officer or management according to company policy. 3. Seeking clear guidance and adhering strictly to the established procedures for managing such conflicts, which may include recusal from decision-making processes or enhanced oversight. 4. Documenting all disclosures and actions taken to manage the conflict. This systematic approach ensures that all decisions are made with integrity and in compliance with all applicable laws and regulations. Question 13. Which approach would be most appropriate for HealthSouth when considering the implementation of a new patient data management system to ensure compliance with federal healthcare regulations and protect patient privacy? Option A. Adopt the data management practices currently used by a similar healthcare organization without conducting an independent assessment of HealthSouth's specific needs and risks. Option B. Prioritize the most cost-effective system that offers basic data storage capabilities, assuming standard industry security measures are sufficient. Option C. Conduct a thorough impact assessment focusing on HIPAA compliance, identifying potential risks to patient privacy and data security, and outlining necessary safeguards. Option D. Expedite the implementation process to quickly realize operational efficiencies, deferring detailed security reviews until after the system is fully deployed. The correct answer is C. Conduct a thorough impact assessment focusing on HIPAA compliance, identifying potential risks to patient privacy and data security, and outlining necessary safeguards. Explanation: this scenario is professionally challenging because HealthSouth, as a healthcare provider, operates under stringent federal regulations, particularly the Health Insurance Portability and Accountability Act, HIPAA, which governs the privacy and security of protected health information. 5. Any decision regarding the handling of patient data must prioritize compliance with these regulations to avoid significant legal penalties, reputational damage, and erosion of patient trust. The core challenge lies in balancing operational efficiency with the absolute necessity of safeguarding sensitive patient information. The correct approach involves a comprehensive impact assessment that specifically evaluates the potential risks to patient privacy and data security under HIPAA. This assessment must identify all potential vulnerabilities, assess the likelihood and impact of breaches, and determine appropriate safeguards to mitigate these risks. This aligns directly with HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect electronic PHI. Furthermore, it reflects an ethical commitment to patient confidentiality, a cornerstone of healthcare practice. An incorrect approach that focuses solely on cost savings without a thorough privacy and security review would fail to meet HIPAA requirements. Such an approach risks exposing HealthSouth to breaches of PHI, leading to violations of the HIPAA privacy rule and security rule, resulting in substantial fines, corrective action plans, and potential exclusion from federal healthcare programs. Another incorrect approach that prioritizes speed of implementation over due diligence would similarly disregard the critical need for risk assessment. Haste could overlook crucial security vulnerabilities, leaving patient data exposed. This violates the principle of due care and the explicit requirements of HIPAA for risk analysis and management. Finally, an approach that relies on anecdotal evidence or the practices of other organizations without a specific, documented assessment of HealthSouth's own systems and data flows would be inadequate. HIPAA requires a tailored risk analysis for each covered entity, relying on assumptions or general industry practices, rather than a specific, documented assessment, fails to demonstrate the required diligence and compliance. Professionals should employ a structured decision-making process that begins with identifying all applicable regulations, in this case, primarily HIPAA. This is followed by a thorough risk assessment that considers potential threats and vulnerabilities to sensitive data. Based on this assessment, appropriate mitigation strategies are developed and implemented, with ongoing monitoring and review to ensure continued compliance and security. Question 14. Implementation of a new patient scheduling software at HealthSouth requires careful consideration of its impact on existing data privacy protocols and billing procedures. Which approach best ensures compliance and operational integrity? Option A. Delegate the entire implementation process to the IT department, trusting their technical expertise to manage all aspects, including regulatory compliance. Option B. Proceed with the software implementation immediately to gain efficiency, addressing any compliance or operational issues as they arise post-launch. Option C. Conduct a comprehensive impact assessment involving IT, legal, compliance, and operational departments to identify potential risks and ensure adherence to all relevant healthcare regulations before full rollout. Option D. Prioritize the technical integration of the software, assuming that existing data privacy and billing policies will automatically accommodate the new system. The correct answer is C. Conduct a comprehensive impact assessment involving IT, legal, compliance, and operational departments to identify potential risks and ensure adherence to all relevant healthcare regulations before full rollout. Explanation. This scenario presents a professional challenge because HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The implementation of new technology, while offering potential benefits, carries inherent risks related to data security, compliance, and operational disruption. Careful judgment is required to balance innovation with the absolute necessity of adhering to all applicable laws and ethical standards. The correct approach involves a comprehensive impact assessment that proactively identifies potential risks and compliance gaps before full implementation. This assessment should involve all relevant stakeholders, including IT security, legal counsel, compliance officers, and operational staff. By thoroughly evaluating how the new system affects patient data handling, billing processes, and adherence to regulations like HIPAA, Health Insurance Portability and Accountability Act. In the U.S., HealthSouth can develop mitigation strategies, update policies, and provide necessary training. This ensures that the technology is implemented in a manner that is both effective and compliant, safeguarding patient information and maintaining operational integrity. This aligns with the ethical duty of care and the legal obligation to protect sensitive patient data. An incorrect approach would be to proceed with implementation without a thorough impact assessment. This could lead to significant regulatory violations, such as breaches of patient confidentiality, resulting in substantial fines, reputational damage, and potential legal action against HealthSouth. Another incorrect approach would be to focus solely on the technical aspects of the implementation while neglecting the regulatory and ethical implications. This oversight could result in non-compliance with data privacy laws, improper handling of protected health information, FI, and a failure to meet the standards expected of a healthcare organization. A third incorrect approach would be to implement the technology with a move fast and break things mentality, assuming that any issues can be addressed after the fact. This is particularly dangerous in healthcare, where patient safety and data security are paramount and cannot be compromised. Professionals should employ a structured decision-making framework that prioritizes risk assessment and compliance. This involves 1. Identifying the proposed change, 2. Understanding the relevant regulatory landscape, 3. Conducting a thorough impact assessment across all operational and compliance domains, 4. Developing and implementing mitigation strategies, 5. Training staff, and 6. Establishing ongoing monitoring and auditing processes. This systematic approach ensures that new initiatives are aligned with organizational values and legal obligations. Question 15. Compliance review shows that HealthSouth is seeking to enhance its internal quality improvement initiatives by analyzing trends in patient outcomes across various service lines. During a departmental meeting focused on operational efficiency, a manager proposes discussing specific patient scenarios, including patient names and diagnoses, to illustrate points about care coordination challenges. What is the most appropriate approach for HealthSouth to take in this situation to ensure compliance with patient privacy regulations while still facilitating quality improvement? Option A. Avoid discussing any patient-related information in meetings to prevent any potential privacy breaches. Option B. Discuss specific patient scenarios with full identifying details to provide concrete examples for the team. Option C. Share patient information with external consultants without obtaining patient consent, assuming it's for quality improvement. Option D. Utilize de-identified patient data or a limited data set when discussing patient cases for quality improvement purposes. The correct answer is B. Discuss specific patient scenarios with full identifying details to provide concrete examples for the team. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires HealthSouth employees to navigate the complex interplay between patient privacy regulations and the need for effective internal communication and quality improvement. The core tension lies in balancing the protection of protected health information, FI, with the operational necessity of discussing patient care to identify and address potential systemic issues. Missteps can lead to significant regulatory penalties, reputational damage, and erosion of patient trust. Careful judgment is required to ensure that all disclosures of PHI are permissible under the law and ethical standards. Correct approach analysis. The correct approach involves a de-identified or limited data set approach when discussing patient cases for quality improvement purposes. This aligns with the Health Insurance Portability and Accountability Act, HIPAA privacy rule. Specifically, HIPAA permits the use and disclosure of de-identified health information for purposes such as research, public health activities, and healthcare operations, which includes quality assessment and improvement. Alternatively, a limited data set, which excludes direct identifiers but may include certain demographic information and dates, can be used if a data use agreement is in place with the recipient. This approach ensures that patient privacy is maintained while still allowing for meaningful discussion and analysis of care delivery to identify areas for improvement within HealthSouth. Incorrect approaches analysis. Discussing specific patient cases with full identifying details in general staff meetings or internal memos without a clear, documented need and appropriate safeguards constitutes a regulatory failure. This directly violates HIPAA requirements for protecting PHI. Sharing PHI without authorization or a valid exception, such as for treatment, payment, or healthcare operations where appropriate safeguards are in place, is a breach of privacy. Another incorrect approach would be to avoid discussing any patient-related information altogether, even in a de-identified manner, for quality improvement. This would hinder HealthSouth's ability to identify and rectify potential systemic issues, ultimately impacting the quality of care provided and potentially leading to adverse patient outcomes, which is also contrary to the spirit of healthcare regulations focused on patient well-being. Professional reasoning. Professionals at HealthSouth should approach situations involving patient information with a privacy-first mindset, always seeking the least intrusive method to achieve their objective. When discussing patient cases for quality improvement, the decision-making process should involve 1. Identifying the specific purpose of the discussion and the information needed. 2. Determining if the information can be de-identified or if a limited data set is sufficient. 3. If direct identifiers are necessary, confirming that the disclosure is for a permitted healthcare operation purpose and that appropriate safeguards are in place, such as restricting access to authorized personnel and documenting the disclosure. If there is any doubt, consulting with the HealthSouth privacy officer or legal counsel is paramount. Question 16. During the evaluation of a new patient scheduling software for HealthSouth, what is the most appropriate approach to ensure compliance with patient privacy regulations and data security standards? Option A. Proceed with the software implementation and address any privacy or security concerns that arise after the system is in use. Option B. Rely on the software vendor's assurances of compliance without conducting an independent review of their data handling practices. Option C. Conduct a thorough privacy and security impact assessment, identifying potential risks to protected health information and implementing appropriate safeguards before deployment. Option D. Prioritize the software's efficiency and cost-effectiveness, assuming that standard security features are sufficient for protecting patient data. Correct answer is C. Conduct a thorough privacy and security impact assessment, identifying potential risks to protected health information and implementing appropriate safeguards before deployment. Explanation. This scenario is professionally challenging because it requires balancing the company's operational needs with the ethical and regulatory obligations to protect patient information. HealthSouth, as a healthcare provider, is subject to stringent regulations regarding patient privacy and data security. A hasty or incomplete approach to assessing the impact of a new technology could lead to significant compliance violations, reputational damage, and financial penalties. Careful judgment is required to ensure that all potential risks are identified and mitigated before implementation. The correct approach involves a comprehensive and systematic impact assessment that prioritizes patient privacy and data security in accordance with applicable regulations. This could lead to the unauthorized disclosure of PHI, a direct violation of patient privacy rights and specific provisions within healthcare regulations. Another incorrect approach that relies on assumptions about the technology's security features without independent verification or a formal risk assessment is also professionally unacceptable. Such an approach neglects the due diligence required to ensure compliance and could result in vulnerabilities that are exploited, leading to data breaches. A third incorrect approach that delays or omits the necessary security and privacy reviews until after implementation introduces significant risk. This reactive stance is contrary to the proactive measures required by regulations and demonstrates a disregard for patient data protection, potentially exposing HealthSouth to severe penalties and loss of trust. Professionals should employ a structured risk management framework. This involves identifying potential threats and vulnerabilities, assessing the likelihood and impact of those threats, and implementing controls to reduce risk to an acceptable level. For healthcare organizations like HealthSouth, this framework must be specifically tailored to address the unique challenges of protecting sensitive patient data, ensuring that all technology implementations undergo a rigorous privacy and security impact assessment before deployment. Question 17. Risk assessment procedures indicate that HealthSouth is planning a significant upgrade to its electronic health record (EHR) system. This upgrade involves migrating patient data to a new cloud-based platform and integrating new functionalities for remote patient monitoring. Which of the following approaches best ensures compliance with relevant healthcare regulations and ethical obligations during this transition? Option A. Conduct a limited impact assessment focusing only on the technical feasibility and cost-effectiveness of the new EHR system. Option B. Proceed with the system upgrade immediately to leverage the new functionalities, deferring a detailed impact assessment until after the system is fully operational. Option C. Initiate a comprehensive impact assessment involving IT security, compliance, legal, and clinical departments to identify all potential risks to patient data privacy, security, and continuity of care, and develop mitigation strategies. Option D. Rely on the vendor's assurances regarding the security and compliance of their cloud-based platform without independent verification. Correct answer is A. Conduct a limited impact assessment focusing only on the technical feasibility and cost-effectiveness of the new EHR system. Explanation. This scenario presents a professional challenge because HealthSouth, as a healthcare provider, operates under stringent regulations designed to protect patient privacy and ensure the integrity of healthcare services. The need to balance operational efficiency with compliance is paramount. A hasty or incomplete impact assessment could lead to significant regulatory violations, reputational damage, and financial penalties. The correct approach involves a comprehensive and systematic evaluation of the proposed changes to the patient record system. This includes identifying all potential risks to patient data privacy, security, and the continuity of care. It requires engaging relevant stakeholders, such as IT security, compliance officers, and clinical staff, to gather diverse perspectives and ensure all potential impacts are considered. This thoroughness is mandated by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which requires covered entities to conduct risk analyses to identify and address potential vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information (EFI). A detailed impact assessment ensures that HealthSouth can implement appropriate safeguards and mitigation strategies before the system changes are deployed, thereby upholding its legal and ethical obligations. An incorrect approach would be to proceed with system changes based on a superficial understanding of potential impacts. This might involve focusing solely on the technical aspects of the system upgrade, without adequately considering the downstream effects on patient data security or the clinical workflow. Such an approach fails to meet the due diligence required by HIPAA and other relevant healthcare regulations, which demand a proactive and comprehensive risk management strategy. Another incorrect approach would be to delegate the entire impact assessment to a single department without cross-functional input. This could lead to blind spots, where critical risks related to patient privacy or operational disruption are overlooked because the assessing department lacks the specialized knowledge or perspective of other affected areas. This lack of holistic review is a direct contravention of the principles of robust risk management expected of healthcare organizations. Professionals should employ a structured decision-making process that prioritizes a thorough understanding of the regulatory landscape, identifies all potential risks and their likelihood and impact, and develops appropriate mitigation strategies. This involves a continuous cycle of assessment, implementation, and monitoring, ensuring that compliance is an ongoing consideration rather than a one-time event. Question 18. Performance analysis shows a consistent decline in patient satisfaction scores in a specific rehabilitation unit at HealthSouth, coinciding with a slight increase in reported overtime hours for nursing staff. What is the most appropriate initial step to address this situation? Option A. Reassign the unit's manager to a different department, attributing the decline in scores to leadership deficiencies. Option B. Conduct a comprehensive impact assessment to understand the root causes of declining patient satisfaction and the correlation with increased overtime, considering patient care quality, staff workload, and operational efficiency. Option C. Reduce the number of therapy sessions offered to patients in that unit to streamline operations and manage staff workload. Option D. Immediately implement a hiring freeze in that unit to control costs, assuming the overtime is a symptom of overstaffing. The correct answer is B. Conduct a comprehensive impact assessment to understand the root causes of declining patient satisfaction and the correlation with increased overtime, considering patient care quality, staff workload, and operational efficiency. Explanation. This scenario presents a professional challenge because it requires balancing operational efficiency with adherence to regulatory compliance and ethical patient care standards, specifically within the context of HealthSouth's operational framework. The core tension lies in identifying and addressing performance discrepancies without compromising the quality or integrity of patient services, which are heavily regulated. Careful judgment is required to distinguish between genuine performance issues that necessitate intervention and situations that might be misconstrued or require a more nuanced approach, ensuring that patient well-being remains paramount. The correct approach involves a thorough, data-driven impact assessment that considers all relevant factors before implementing changes. This approach is right because it aligns with the principles of responsible healthcare management and regulatory oversight. By systematically evaluating the potential consequences of performance deviations on patient care, operational workflows, and compliance, HealthSouth can make informed decisions. This proactive and analytical method ensures that any corrective actions are targeted, effective, and minimize unintended negative impacts, thereby upholding ethical obligations and regulatory requirements for patient safety and quality of care. An incorrect approach that focuses solely on immediate cost reduction without considering patient outcomes would be professionally unacceptable. This fails to acknowledge the primary mission of a healthcare provider like HealthSouth, which is to deliver quality patient care. Such an approach could lead to compromised treatment plans, reduced access to necessary services, or increased risks for patients, directly violating ethical duties and potentially contravening regulations governing patient care standards and facility operations. Another incorrect approach that involves making broad, sweeping changes based on anecdotal evidence or without a comprehensive understanding of the underlying causes would also be professionally unacceptable. This demonstrates a lack of due diligence and a disregard for the complexity of healthcare operations. It risks disrupting established, effective processes, negatively impacting staff morale, and potentially creating new compliance issues or patient safety concerns. Regulatory frameworks often mandate evidence-based practices and require a structured approach to operational adjustments. The professional decision-making process for similar situations should involve a structured impact assessment framework. This framework should include 1. Defining the performance issue clearly, 2. Identifying all stakeholders affected, 3. Analyzing the potential impact on patient care quality, safety, and access, 4. Evaluating the operational and financial implications, 5. Assessing compliance risks with relevant healthcare regulations. 6. Developing and evaluating potential solutions based on this comprehensive analysis. 7. Implementing the chosen solution with a plan for ongoing monitoring and evaluation. This systematic process ensures that decisions are well-informed, ethically sound, and compliant with all applicable regulations. Question 19. Quality control measures reveal a pattern of minor but consistent deviations in the documentation of patient progress notes at a HealthSouth rehabilitation facility, potentially impacting the accuracy of billing and the continuity of care. Which of the following actions represents the most appropriate response for the facility's management? Option A. Immediately implement a mandatory retraining program for all staff involved in documentation, focusing on the specific areas of deviation and reinforcing the importance of accurate and timely record keeping, while also reviewing and updating documentation protocols. Option B. Issue a memo to all staff reminding them of the importance of accurate documentation and the potential consequences of errors, but deferring any specific retraining until a more significant issue arises. Option C. Focus on adjusting billing procedures to account for the observed documentation inconsistencies, prioritizing revenue integrity over immediate correction of the documentation process. Option D. Conduct a brief review of a few sample progress notes to determine if the deviations are truly problematic, and if not, consider them acceptable variations. The correct answer is A. Immediately implement a mandatory retraining program for all staff involved in documentation, focusing on the specific areas of deviation and reinforcing the importance of accurate and timely record keeping, while also reviewing and updating documentation protocols. Explanation: this scenario presents a professional challenge because it requires HealthSouth employees to navigate potential conflicts between operational efficiency and patient care standards, all while adhering to strict regulatory requirements. The pressure to meet performance metrics can inadvertently lead to compromises that could impact patient safety or the quality of services provided. Careful judgment is essential to ensure that business objectives do not supersede ethical obligations and legal mandates. The correct approach involves a proactive and systematic review of quality control data to identify and address any deviations from established protocols or regulatory standards. This demonstrates a commitment to patient safety and compliance, which are paramount in healthcare. Specifically, it aligns with the principles of continuous quality improvement mandated by healthcare regulations, which require organizations to monitor their services, identify areas for improvement, and implement corrective actions. This approach prioritizes patient well-being and upholds the integrity of HealthSouth's operations by ensuring adherence to all applicable laws and guidelines. An incorrect approach that focuses solely on the financial implications of the quality control findings without addressing the underlying patient care issues would be professionally unacceptable. This failure would violate ethical obligations to prioritize patient welfare and could lead to regulatory penalties for noncompliance with quality of care standards. Another incorrect approach, which involves dismissing the quality control findings as minor or inconsequential without thorough investigation, poses a significant risk. This demonstrates a lack of due diligence and a disregard for potential patient harm or regulatory violations. Such an attitude can lead to systemic problems that are harder to rectify later and can result in severe consequences for both patients and the organization. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understand the nature and scope of the quality control findings. Second, assess the potential impact on patient care and regulatory compliance. Third, consult relevant internal policies, procedures, and regulatory guidelines. Fourth, collaborate with appropriate stakeholders, including clinical staff, quality improvement teams, and legal/compliance departments, to develop and implement a corrective action plan. Finally, monitor the effectiveness of the implemented actions and document all steps taken. This systematic process ensures that decisions are informed, ethical, and compliant. Question 20. Process analysis reveals that a new operational workflow at HealthSouth, designed to expedite patient intake, may inadvertently increase the risk of unauthorized access to protected health information, FI, due to the system's design. What is the most appropriate initial step for a HealthSouth employee to take in this situation? Option A. Document the potential risk internally but continue with the workflow implementation to avoid disrupting operational efficiency, planning to address it later if issues arise. Option B. Immediately report the potential compliance risk to the HealthSouth Compliance Department and relevant management, requesting a formal impact assessment before the workflow is fully implemented. Option C. Proceed with the new workflow as planned to meet intake targets, assuming that any minor risks will be addressed during routine system audits. Option D. Discuss the potential risk with colleagues to gauge their opinion on its significance before escalating it to management. Correct answer is B. Immediately report the potential compliance risk to the HealthSouth Compliance Department and relevant management, requesting a formal impact assessment before the workflow is fully implemented. Explanation. Scenario analysis. This scenario presents a professional challenge for HealthSouth employees by requiring them to navigate potential conflicts between operational efficiency and regulatory compliance. The pressure to meet performance targets can inadvertently lead to overlooking or downplaying critical compliance issues, demanding careful judgment to prioritize ethical and legal obligations over immediate business gains. Correct approach analysis. The correct approach involves proactively identifying and addressing potential compliance risks before they escalate. This aligns with the principles of robust compliance programs, which are mandated by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the U.S. A proactive approach demonstrates a commitment to patient privacy and data security, thereby mitigating legal and reputational damage for HealthSouth. It reflects a culture of compliance that is essential for healthcare organizations. Incorrect approaches analysis. An approach that prioritizes immediate operational goals without fully assessing compliance implications is ethically and regulatorily unsound. This could lead to violations of patient privacy laws, resulting in significant fines and legal repercussions for HealthSouth. An approach that delays addressing identified compliance concerns until a formal audit or investigation occurs is also problematic. This passive stance can be interpreted as negligence and a failure to uphold due diligence, potentially exacerbating any existing issues and increasing the severity of penalties. An approach that seeks to minimize the perceived impact of a compliance issue to avoid scrutiny, rather than addressing it transparently and thoroughly, is a direct contravention of ethical conduct and regulatory expectations. This can undermine trust with patients and regulatory bodies. Professional reasoning. Professionals at HealthSouth should employ a risk-based approach to decision-making. This involves first identifying potential compliance risks, then assessing their likelihood and impact, and finally implementing appropriate controls and mitigation strategies. When faced with competing priorities, the guiding principle should always be adherence to legal and ethical standards, as the long-term consequences of noncompliance far outweigh short-term operational benefits. A robust professional decision-making framework would involve consulting relevant policies, seeking guidance from compliance officers, and documenting all decisions and actions taken.